The fluorescent lights hummed their endless mechanical song as Katie Morrison pushed through the double doors of Cedar Creek Medical, her scrubs still damp from the pre-dawn rain outside. Nobody noticed her. That was the point. That was always the point. She moved through the fourth-floor surgical wing with the quiet efficiency of someone who had spent 3 years perfecting the art of being invisible, her Navy captain credentials buried so deep in Pentagon databases that even she sometimes forgot the weight they once carried. The DoD system had her listed as deceased. Killed in action, Helmand Province, 2021. Officially erased from all military records after a classified operation went sideways in ways the government would never admit. Now she was just Katie, RN, Cedar Creek Medical, Raleigh, North Carolina. Just another nurse restocking supplies without meeting anyone's eyes. The antiseptic smell wrapped around her like a second skin, mixing with something metallic underneath, the tang of fear she could still taste from sandstorms and mortar fire, a flavor that never quite washed out no matter how many shifts she worked. Her hands moved through muscle memory as she checked the crash cart on 4 North, counting doses of epinephrine, verifying the airway supplies, running her fingers across equipment the way some people touch prayer beads. One quick survey. One deep breath. Everything in its place. A resident named Chen nearly walked into her in the hallway, his tablet clutched to his chest, his eye somewhere in the ceiling. Katie stepped aside without a word, pressing herself against the wall with the practiced grace of someone who had learned to take up less space. Chen didn't even register that she existed. Most of them didn't. Most of them never would. That was fine. That was survival. Room for 47 was her last stop on the morning circuit, and the moment she pushed through the door, she knew Lieutenant Hayes was awake. His eyes tracked her movements with the careful attention of someone still riding a morphine drip, still confused about which parts of reality were real and which parts belonged to the drug dreams. Shrapnel wounds from an IED near Sanjin Valley, 3 weeks ago now. He'd been lucky. Half an inch to the right and his femoral artery would have opened like a faucet. Half an inch. "Good morning, Lieutenant," she said, her voice soft and deferential in the way she had perfected over 36 months of invisibility. "How are the pain levels?" His eyes focused on her face, searching, and she felt the exact moment his morphine-clouded memory failed him. She knew what he was seeing, a stranger in scrubs, a nurse he'd never met before, someone new to his rotation. Not the captain who had carried him 3 miles through hostile fire while rounds snapped overhead like angry wasps. Not the woman whose voice had cut through the chaos of Helmand Province like a blade through silk, singing coordinates into a radio handset while blood soaked through her uniform. Not the legend whose call sign, Al-Saida Al-Zaka, the Blue Lady, had haunted enemy radio chatter across 3 provinces. Just a nurse. Someone new. "I'm okay," he said, his voice rough from disuse. "You new here?" "Haven't seen you before." Katie's eyes dropped to his forearm, where her name was inked in stark black letters, Katie, with coordinates underneath. 39.227 degrees north, 65.855 degrees east. The exact grid reference where she'd found him bleeding out in the rubble of a marketplace. The tattoo was a thank you, a memorial, a bridge between 2 people whose lives had been welded together by fire and circumstance and the kind of obligation that never quite releases its grip. She didn't correct him. She didn't tell him who she was. She simply smiled, steady and sure, and adjusted his foot drip with hands that knew exactly what they were doing. "Just started last month," she said, which was a lie and not a lie simultaneously. She'd been working Cedar Creek for 3 years. But in his world, in the world of patients who came and went, of morphine nights that swallowed memory whole, she was new. She would always be new. That was the bargain she'd made with herself, they would never see the woman underneath the scrubs. Nobody would. "You're good at this," Hayes said, watching her movements. "Really good. Like you've done this 1,000 times. 2,000, she thought. But she said nothing. She just continued her work, her hands moving with the terrifying fluid precision of someone who had learned to save lives in conditions that would have broken most people. Her fingers were steady as they checked his vitals, steady as they documented his progress in the chart, steady as she fought the tremor that always came when the door opened and Dr. Marcus Mercer appeared in the hallway outside. She felt it before she saw him, that shift in air pressure, the way a room seemed to contract when he moved through it. She'd learned to recognize the warning signs, the soft scrape of designer scrubs, the click-click-click of Italian shoes on linoleum, the sound of someone whose presence wanted the world to acknowledge how important he was. She didn't look up from Hayes's for line. She didn't need to. She could feel Mercer's gaze on her like a thermal signature, like something with teeth. He was watching from the doorway, observing the way the patient tracked Katie's movements, the way the residents who passed by in the hallway slowed their pace when she was near, seeking her opinion before they sought his. His jaw was tight. His hands were clenched. He looked like someone who had just realized he was smaller than he thought he was, and the realization was making him angry in ways he didn't quite understand yet. Katie's hands trembled for exactly 1 second. Just one. A whisper of movement, barely perceptible, as if her nervous system was acknowledging a threat that her conscious mind was trained to ignore. It was the weight of the hidden rank, the burden of the buried credentials, the knowledge that one record check, one phone call to the right person, one curiosity from the wrong administrator could unravel everything she'd constructed. It was the fear that someone would finally look closely enough to see what was actually standing in front of them. A captain. A legend. A woman who had been officially dead for 3 years and couldn't afford to come alive again without destroying the peace that she'd worked so hard to build. She steadied her hands. Drew a breath. Continued working. Hayes was talking about his discharge timeline, when he might get cleared for light duty, whether the physical therapy would be rough, whether he'd be able to return to full status. Katie listened with the kind of attention that suggested she cared about every word, even though her mind was elsewhere, tracking the man in the doorway, monitoring his mood, calculating angles and exits like she was back in Helmand Province with a radio headset and nothing but training between her and catastrophe. The doctors say another 3 weeks minimum, Hayes was saying. Probably more. I hate being sidelined. Better sidelined than disabled, Katie said softly. Give your body time to heal. You've earned it. It was a lie. She knew what his medical file said. She'd reviewed it during the night shift when the floors were quiet and the records were accessible. The shrapnel had done more damage than the surface wound suggested. The nerve damage alone might cost him mobility in his left leg. 3 weeks was optimistic. But there was no reason to tell him that, especially not with Mercer watching from the doorway like a predator calculating whether prey was worth the hunt. She checked the morphine pump, verified the settings, made a note in his chart. Professional. Competent. Invisible. The way she'd learned to be invisible was to be excellent at what you did but never demand credit for it, to be so reliably good that people stopped noticing you were there at all. She was the background radiation of Cedar Creek Medical, present in every good outcome, absent from every conversation, woven into the fabric of the hospital's success like a ghost who had learned to haunt only the places where nobody thought to look. You're going to be okay, she told Hayes, and she meant it. He would recover. His body was young and strong. Time would do most of the work. Just be patient with yourself. She turned to leave the room and found Mercer still standing in the doorway, blocking her exit. Not physically, he was standing to the side, but the weight of his presence made it feel like a barrier. His eyes moved over her uniform, cataloguing, assessing, searching for something he couldn't quite articulate. She met his gaze for just a fraction of a second, that brief acknowledgement between two people who understood that the other one was taking up space, and in that moment, she saw the flicker of something dangerous cross his face. Recognition, maybe. Or just the beginning of it. But then the moment passed. Katie stepped past him into the hallway with the same quiet efficiency with which she did everything else. Behind her, she heard Hayes asking Mercer something about his treatment plan, heard the doctor's voice shift into its professional register, heard the walls of Cedar Creek Medical settle back into their normal rhythm. The fluorescent lights continued their endless mechanical song. The antiseptic smell persisted in the air like a memory that wouldn't fade. And somewhere in the faded unit patch sewn inside her white coat lining, Katie carried the weight of 17 lives she had saved in Helmand Province, a captain's rank that didn't exist anymore, and the knowledge that staying invisible was the same as staying alive. What happened next would change everything. Thursday morning at Cedar Creek Medical arrived with the kind of fluorescent brightness that made everything look sterile and false. Grand rounds moved through the corridors like a parade, Dr. Mercer leading a cluster of residents and attending physicians in their white coats, their stethoscopes draped like ribbons of authority. The visiting lecturer from Duke had finished her presentation on post-operative complications, and Mercer seized the moment the way a predator recognizes wounded prey. He paused mid-stride near room 407, where Katie Morrison stood checking the surgical drain on a patient's abdomen, her hand steady as she measured the output, documented the color, ensured the tubing remained patent. She didn't look up. She'd learned years ago that looking up only invited conversation. "Let's discuss scope of practice, shall we?" Mercer's voice carried the artificial warmth of a knife wrapped in silk. The residents turned as one, sensing entertainment. Nurse Morrison here represents a cautionary tale, one we see more often than we'd like. He gestured at Katie like she was a specimen under glass. Nurses who think a few years of bedside care qualifies them to make clinical decisions reserved for physicians. The drain tube hissed slightly as Katie flushed it with saline. Her jaw tightened. Not enough for anyone but herself to notice. "I've observed her type before," Mercer continued, warming to his audience. Confident. Assertive. Utterly unaware of what she doesn't know. He smiled at the residents. The smile of a man convinced of his own brilliance. It's dangerous, frankly. Playing doctor without the pedigree to back it up. Without the training. Without the accountability that comes with an actual medical degree. One of the senior residents smirked. Another shifted his weight, uncomfortable but not uncomfortable enough to speak. The attending physician from Duke adjusted her glasses and said nothing. Katie finished documenting, capped the drain, and turned to face him. Her eyes met his for exactly 3 seconds, cold, flat, the color of a winter sky over the Atlantic. No tremor. No flush. No retreat. Just a woman looking at a man the way one might regard something crawling across a sidewalk. Then she turned back to her patient, dismissing him the way one dismisses a child's tantrum. Mercer continued talking to fill the void, but his momentum had fractured. The residents followed him onward, though something had shifted in the texture of the moment. Katie didn't hear the rest. She didn't need to. She'd learned in Helmand Province that the words men spoke when they felt threatened were never their actual words, they were echoes of their own fragility, bouncing off walls made of fear. By mid-afternoon, the hospital corridors had settled into their usual rhythm. Medication carts rattled. Pagers chimed. Monitors beeped in their endless mechanical chorus. Katie stood at the vending machine in the break room, inserting coins with methodical precision, when Dr. Mercer rounded the corner with 2 hospital administrators in tow. They were pretending not to listen. This was the pretense that made the setup perfect. "I'm just saying," Mercer's voice was confidential, the tone of a man sharing legitimate concerns with colleagues, "this alleged military experience on Morrison's resume, has anyone actually verified it?" He dropped coins into the machine with theatrical precision. "Anyone can claim they served. Resume padding is more common than you'd think, especially among people trying to compensate for lack of real credentials." The machine hummed. Katie's vending selection glowed green. She didn't move. "I've contacted some colleagues at Walter Reed," Mercer continued, his voice building. "People who would certainly know if a Captain Morrison had served in their ranks. Know what they told me?" He paused for effect, like he was narrating a television drama. "Nobody's heard of her. Not a single officer recognized the name. Makes you wonder what else has been fabricated." One of the administrators checked their watch. The other stared at their phone screen with sudden, consuming interest. Katie's hand was steady as she pulled open the vending machine door and retrieved her selection, a bottle of water, nothing more. She turned slowly. Deliberately. Mercer's eyes went to her face and the confidence in his expression flickered like a candle in wind. "Ah, Nurse Morrison," he said, pitching his voice higher, friendlier, the way one speaks to someone they've just decided doesn't matter. We were just discussing professional integrity. The silence stretched. 5 seconds. Long enough for one of the administrators to suddenly remember an urgent email. Long enough for Mercer's smile to calcify on his face. When Katie spoke, her voice was surgical precision-made sound, each word placed with the care of a scalpel finding tissue. The difference between us, Dr. Mercer, is that I've actually had to answer for my mistakes. She didn't raise her voice. She didn't point. She didn't perform. She simply stated a fact the way one states that water boils at 100 degrees Celsius, and then she turned and walked away, her footsteps echoing down the corridor, left foot, right foot, the rhythm of someone who had walked through worse than this and simply kept walking. Behind her, Dr. Mercer's face flushed a color that would have registered on a blood pressure cuff. His mouth opened. Closed. Opened again. The residents who'd followed him had stopped moving. One actually looked away, embarrassed on his behalf. The administrators had developed an urgent need to be anywhere else, and within 15 seconds, the corridor held only the ambient hum of machines and the fading sound of Katie's footsteps. That evening, Mercer pulled the charge nurse into his office, and his voice was the voice of a man whose facade had cracked and was determined to seal it back together before anyone noticed the damage. "I'm concerned about Nurse Morrison's stability," he said, his tone heavy with false concern. "Her confrontational attitude earlier today, did you observe that? The way she spoke to me in front of administrators? That's not normal. That's not professional." The charge nurse, a woman named Sandra who'd worked at Cedar Creek for 14 years and had learned that survival meant not making enemies of either doctors or nurses, made non-committal sounds. "I think we need to document this," Mercer continued, his mind already working through the calculus of destruction. Pattern of insubordination. Boundary violations. I've seen this before. Someone becomes convinced they're more capable than they are, and then they become a liability. He leaned back in his chair, his fingers steepled. "I'll need you to keep an eye on her. Document any incidents. Anything that suggests concerning behavior patterns." The charge nurse left his office understanding that she'd just been conscripted into a war she hadn't declared. The seeds had been planted, dark and viable, and in the soil of institutional hierarchy they would grow with terrifying speed. Katie didn't know any of this yet. She was in the ICU, checking on a post-operative cardiac patient, her hands gentle and her attention absolute. The unit patch sewn inside her white coat lining, faded now, the edges fraying slightly, the insignia of a unit that officially no longer claimed her, seemed to weigh more than it had that morning. She'd learned long ago to carry weight. She'd learned in a place where stones held the heat of the sun for hours after dark, where the air tasted like diesel and dust, where 17 lives depended on someone making a decision in the space of a heartbeat. She'd survived that. She could survive this. The night shift began at 7 o'clock with the kind of deceptive quiet that hospital nights sometimes carried, the building settling, the daytime machinery powering down, the skeleton crew moving through corridors lit by the low-level glow of nighttime signage. Katie changed into her night shift scrubs at 18:45, clocked in at 18:55, and was reviewing patient charts by 19:05 when the first sign appeared. Room for 47. Lieutenant Hayes. His oxygen saturation was dropping. The oxygen saturation monitor beeped its warning at 2:27 a.m. 87% and dropping. Lieutenant Hayes gasped like a fish pulled from water, his chest heaving against the hospital bed rails, his skin taking on that grey-white pallor Katie recognized from Helmand Province, the color of a body shutting down. His eyes went wide. Panic was setting in. That made everything worse. Katie was at his bedside before his call light even registered on the station monitor. She didn't run. Running would alert the charge nurse. Running would bring Mercer, and Mercer would waste 3 minutes establishing authority before actually helping. She moved with the controlled precision of someone who had done this in sandstorms and under mortar fire, when hesitation meant body bags. "Breathe with me," Katie said, her voice pitched low and steady. "Not fast. Slow. In through your nose." Hayes couldn't manage it. His respirations were rapid, shallow, desperate. 84% now. The heart monitor climbed, 118, 124, 131. His neck veins distended like cords beneath his skin, visible even in the pale fluorescent wash. Subcutaneous emphysema, that crackling sensation under the dermis when air pocketed into the tissues, was already starting. Katie could feel it when she placed her palm against his right shoulder. The tissue crackled like bubble wrap under a footstep. Tension pneumothorax. Air was accumulating in the pleural space, collapsing his right lung, compressing his heart toward the left. In the field, they called it the silent killer because it looked like panic, but it was anatomy screaming. At this rate, his blood pressure would follow the oxygen curve downward. He had minutes before cardiac arrest. Katie had already moved to the medication cart, her hand steady as the surgical steel of the instruments she'd used in extraction zones. She grabbed the emergency kit from the trauma shelf, a 14-gauge angiocath needle, already prepped, already sterile. Her muscle memory took over. The movements weren't conscious anymore. They belonged to someone else. Someone named Morrison. Someone who had held lives together with nothing but a needle and nerve. "I need you to stay still," Katie told Hayes, and that was when she felt it, the weight of the decision. The on-call surgeon was in bed somewhere across Raleigh, probably 40 minutes out if she called now. The ER attending was 2 floors down with a stabbing victim and a pediatric head trauma. There was protocol. There were hierarchies. There were forms. And Lieutenant Hayes had for minutes before his myocardium collapsed into itself. She didn't call. She located the second intercostal space, mid-clavicular line, right side. The anatomical landmark where air could escape and the lungs could re-expand. Her fingers found the spot with the certainty of someone who had done this before, in a Humvee, in a compound, in a desert where the only anesthesia was adrenaline and the only witness was a 19-year-old Marine whose leg had stopped bleeding because there was no leg anymore. The needle went in. The hiss of air escaping was immediate. Pure. Like opening a pressurized can. Katie's jaw stayed locked, her breathing steady, her eyes on the monitor as the numbers began their climb. 87. 90. 93. 96. The monitor's rhythm steadied. 108 beats per minute, still elevated but no longer in the territory of imminent cardiac arrest. Hayes's respiration slowed. His neck veins began to recede. Color returned to his face like someone turning up a dimmer switch. "Easy," Katie whispered. "Easy. You're going to be okay." She kept the needle in place, secured it with a sterile dressing, and began the paperwork with the same mechanical precision she'd used for the procedure. Notation at 2:38 a.m. Patient presented with acute respiratory distress and hypoxemia consistent with tension pneumothorax. Right-sided breath sounds absent. Tracheal deviation noted. Emergency needle decompression performed. Second intercostal space, mid-clavicular line. Patient response immediate and positive. Oxygen saturation post-procedure, 98%. Heart rate normalized to 96 beats per minute. The facts. Clean. Clinical. Defensible. Hayes's eyes found hers, dazed and grateful. How did you? Shush, Katie said. Just rest. The doctor will be here in a few minutes to check on you. But that wasn't what happened. Dr. Mercer arrived exactly 11 minutes later, moving through the ICU with the territorial swagger of a man who owned the air he walked through. His eyes went first to the monitor, steady vitals, stable oxygen saturation, sinus rhythm. Then to the needle decompression kit on the bedside table. Then to Katie's face. And in that moment, she watched something shift behind his eyes. Not concern. Not gratitude. Recognition. Recognition that she had done something he couldn't have done faster, and that recognition hardened into something sharp and weaponized. Who performed this procedure? His voice was clinical, but his jaw was clenched tight enough to fracture enamel. Lieutenant Hayes was in acute distress, Katie said, documenting the vitals. Tension pneumothorax. Oxygen saturation 84 and dropping. I performed needle decompression while waiting for surgical. I didn't ask for a narrative. Mercer's gaze swept over Hayes's chart with the violence of a surgeon dissecting tissue. I asked a specific question. Who performed this? The rhythm was dangerous here. The way he spaced the words. The way his presence seemed to pull all the oxygen from the room, making everything smaller and thinner. Katie had learned long ago that there were fights you could win and fights that would cost more to win than to lose. This was the second kind. I did, she said. Patient was deteriorating. Procedure was indicated. Vitals are stable. Mercer's smile was the smile of a predator who'd just spotted an injury in the herd. A nurse, he said, his volume pitched just high enough to carry past Hayes's door, into the hallway where the graveyard shift crew was beginning to move. A nurse performed invasive emergency surgery without physician consultation, without attending presence, without, he paused, letting the silence breed suggestion. Without proper training. Katie didn't correct him. She didn't explain that she'd performed this procedure 47 times, that she'd done it in conditions that would make Cedar Creek's sterile environment look like a 5-star resort, that she'd saved lives with nothing but hands and nerve and the kind of muscle memory that came from doing hard things when the cost of failure was a body bag. She simply returned to her charting, her handwriting precise and unshaking, each letter a brick in a wall she was building between herself and what came next. Mercer stood there for exactly 30 seconds, his eyes boring into the side of her face like he was trying to burn through bone and reach the lie beneath. Then he turned and walked out, already dialing his phone, the glow of the screen visible even from Katie's station as he moved past the nurse's desk. "Get me the hospital attorney," he said. Then, "And Patricia Wells at Duke. Tell her I need a favor." The night shift continued. Vital signs remained stable. Medications delivered, charts updated, the machinery of hospital care grinding forward with its usual indifference to the human dramas unfolding around it. By 6 a.m., when day shift began their changeover, Katie had already been pulled into a meeting with the charge nurse, who kept apologizing, as she explained that Dr. Mercer had filed a formal complaint and that HR was opening an investigation into unauthorized advanced procedures performed outside the scope of nursing practice. But that wasn't the worst part. That wasn't the part that came on Monday morning when Dr. Patricia Wells from Duke appeared in a charcoal suit and carrying a leather portfolio, and Mercer escorted her through the unit like a tour guide showing off inventory. That wasn't the part where Katie watched her former supervising nurse from Norfolk take a phone call from someone asking very specific questions about her stability, her judgment, her tendency toward impulsivity. That wasn't the part where the hospital attorney requested a formal meeting, his fingers steepled like a man about to deliver bad news. That was the part that came Thursday morning at 8 a.m. when the HR director, the same woman Katie had held on her shoulder while her father coded in the CCU, the same woman who had wept and whispered thank you while Katie's hands still had blood on them, handed her a termination letter with a human resources seal and avoid eye contact that was its own kind of cruelty. Immediate suspension pending investigation, the director read, her voice thin and stretched. Unauthorized medical procedures. Scope violation. Credential irregularities. Katie didn't fight. The letter sat on her lap like a live thing. Security was already calling, already at the desk, already waiting with that apologetic posture of people who'd been trained to do something they hated. Katie packed her locker with the efficiency of someone who had learned to leave places fast. The cracked ceramic mug from Kandahar with its faded Marine Corps logo, 13 years old, gift from a gunnery sergeant who died in 2019. The dying succulent on the shelf that someone had given her years ago. The photograph of her unit from Helmand, 7 faces still alive then, 2 of them gone now, 1 missing 3 fingers, another doing prison time for what he'd seen. The security guard was maybe 22, with nervous hands and a name tag that read Martinez. He kept apologizing as he walked her through the lobby, both of them moving past the morning shift arriving for their 12-hour tours, past the gift shop with its cheerful balloons and its flowers meant to heal, past the double doors that opened onto Blount Street where Raleigh was already breathing its humid Tuesday morning air. "I'm sorry," Martinez said. "I'm really sorry." Katie didn't respond. She carried her cardboard box past the parking garage and down 2 blocks to the bus stop where the rain was coming sideways and the sky had that greenish quality that meant a storm was building. She stood there in scrubs she'd forgotten to change, with her hair still in its bun and her badge still clipped to her collar, holding a box that contained everything the last 3 years of her reinvention had added up to. The rain hammered like applause. She reached into her jacket pocket and felt the unit patch sewn into the lining, 3 inches of faded cloth with a call sign stitched in gold thread that hadn't been her name in official records for 12 years. Al-Saida Al-Zaka. The Blue Lady. It was a ghost name now, the kind of name that lived only in files the Pentagon had already buried. The bus was late. The sky continued its warning rumble. And somewhere in Raleigh, Dr. Mercer was making another phone call, beginning the next phase of the operation that was designed to make sure Katie Morrison, whoever she actually was, never worked in medicine again. Within 48 hours, Dr. Mercer's phone became a weapon. 3 board members, Sterling, Hayes, and Bancroft, owed him favors from years of political maneuvering. A single call to each one planted the seed. Katie Morrison's judgment was questionable. Her decision-making under pressure showed signs of instability. The needle decompression she'd performed without surgical authorization was exactly the kind of reckless intervention that could get people killed. Dr. Mercer didn't raise his voice. He didn't need to. His tone was clinical, concerned, the voice of a colleague warning other colleagues about a liability. Each board member took notes. Each one promised to look into it. The references came next. Katie had listed 3 previous supervisors on her employment file, a charge nurse from Duke, a nursing director from UNC, and a trauma surgeon from Vidant Health in Greenville. Dr. Mercer called all 3. His voice was always apologetic. He hated to bring this up, but he had concerns about her clinical judgment and her emotional stability. Had they noticed anything similar during her tenure? Any instances where she'd made decisions without proper oversight? Any behavioral flags? The charge nurse from Duke hesitated. The nursing director from UNC mentioned an incident from 3 years ago, nothing serious, just a conflict with a resident, resolved internally. The trauma surgeon from Vidant didn't remember her at all. But the seed was planted in each conversation, and seeds grow in institutional soil. By the second afternoon, an external consultant arrived at Cedar Creek Medical. Dr. Patricia Wells held credentials from the Joint Commission, the accrediting body that hospitals feared like a siren in the night. She was thin, precise, her eyes the color of spent ammunition casings. Dr. Mercer had worked with her before on other quality reviews. Her assignment was to examine Katie's pattern of unauthorized interventions, the needle decompression being the most recent, but were there others? Mercer had documentation. He had pull requests, incident reports, conversations with nurses who'd witnessed Katie's overreach. None of it was explicitly false. All of it was true in the way that a photograph taken from exactly the wrong angle is true. Wells spent 6 hours at Cedar Creek reviewing charts. She interviewed 5 staff members, all of them carefully selected by Mercer, all of them willing to describe Katie as competent but concerning, dedicated but unpredictable. The picture that emerged was of a nurse operating in a gray zone, making critical calls without authorization, creating liability for the hospital. By evening, Wells had her preliminary assessment. It wasn't a question of whether Katie had saved Lieutenant Hayes' life. Of course she had. The question was whether she'd violated the chain of command, whether she'd exposed the hospital to liability, whether her judgment could be trusted to follow protocol instead of acting on impulse. The recommendation was clear: immediate suspension pending full investigation. The security escort came at 6:02 a.m. the next morning. Katie was in the break room drinking coffee that had gone cold, watching rain streak the window, when her badge was taken and her supervisor arrived with 2 hospital security officers. The words were formal. "You're placed on immediate suspension effective immediately, pending investigation. You'll need to gather your personal items and vacate the premises." It wasn't a request. It was a command delivered with the kind of professional distance that made it worse than any anger. Other nurses averted their eyes as she moved through the corridors with the security officers flanking her like marshals escorting a prisoner. Nobody said anything. Nobody made eye contact. The code of silence in hospitals ran deeper than loyalty. It was the silence of self-preservation, the understanding that speaking up meant being next. Katie retrieved her locker contents, 3 pens that didn't work, a half-empty bottle of ibuprofen, a cracked mug from Kandahar with a faded blue insignia, a dying succulent in a ceramic pot, and a photo in a plastic frame. The photo was her unit in 2019, dusty, squinting into the Helmand sun, teeth white in dark faces. She counted the faces. 17 soldiers in the frame. 6 of them were gone now. She'd attended 3 funerals. 2 of them had been closed caskets. That night, Katie stood at a rain-soaked bus stop on Western Boulevard, clutching a cardboard box as water seeped through the corroded bottom. The succulent tipped sideways against the cracked mug. Headlights blurred through the downpour. Buses passed without stopping. She'd missed the last 3. The rain was Kandahar cold, the kind that cut through clothes and found skin, and Katie stood motionless, letting it soak through her jacket. A faded unit patch was sewn into the lining of that jacket. She could feel its outline against her ribs. 17 souls in that photo. She'd saved more than that in Helmand. The record said 43 evacuations under her command. But somewhere in those numbers, the distinction between alive and saved had blurred. For 18 years she had walked these corridors, healing the broken, holding the dying, and not once had anyone asked her name. Now she was invisible in the way that ghosts are invisible, present but unmourned, erased but not gone. The rain drummed against the cardboard box. The photo swam. She could see the faces in her mind perfectly, but in the photograph they were already beginning to fade, water droplets making their features run and blur like watercolor. For the first time since Helmand Province, since the operation that had killed her twice, once in reality, once in record, Katie Morrison wondered if staying invisible was the same as staying alive. If erasing herself to protect classified operations meant she'd already died in every way that mattered. The bus pulled up. She almost didn't board it. But muscle memory took over. Her hand lifted. Her body moved. The door hissed open like escaping air. 3 days later, Cedar Creek Medical received a federal transfer. Rashid al-Hamadi, former Taliban fighter, now cooperating with federal authorities in exchange for asylum, providing intelligence on Iranian weapons shipments across the tribal border regions. He came to Cedar Creek under 24-hour guard because that's where the medical care was, and even people who tried to kill Americans got treated here. The marshals logged in at 2:34 p.m. Katie wasn't scheduled. Katie was suspended. But Cedar Creek was short-staffed and bureaucracy moved slow, and her badge still granted access to supply closets on the 2nd floor where nobody was watching, where she could be useful without violating any formal restrictions. She was restocking for lines when the marshals escorted their handcuffed prisoner down the corridor toward the secure wing. 2 of them, both carrying, both alert. Rashid al-Hamadi was thin, with the kind of scarred hands that told stories of violence survived. His eye scanned the hallway as if counting exits. Then they locked onto Katie's face and he stopped so abruptly the marshal stumbled backward. The prisoner's body went rigid. His voice came out in a whisper, but in the quiet corridor it carried like a shout through a wire-guided radio. Al-Saida al-Zaka. The Blue Lady. Katie's blood turned to ice water in her veins. The 4-box dropped from her hands and crashed against the tile with a sound like bones breaking. A Marine Staff Sergeant providing security for another patient, Gunnery Sergeant Chen, tattoo sleeve visible below his rolled-up sleeves, jaw like a deployed landing craft, had been walking 40 feet behind them. His head snapped around at the words. His body language changed in the space of a heartbeat. The casual alertness of a bored security detail transformed into something lethal and focused. "What did you just say?" Chen's voice cut through the ambient hum of the hospital like a blade finding cartilage. Rashid's eyes never left Katie. He spoke in Pashto accented English, his voice trembling. "The Blue Lady. She is legend. In Helmand, we called her Al-Saida Al-Zaka, the American with blue hands. Radio operators spoke her name like a curse. Chen moved toward them, his hand already reaching for his hip where a secure tablet hung. Other staff were gathering now, drawn by the commotion like animals sensing a presence change in the room. A nurse from oncology. 2 residents from internal medicine. An orderly frozen with a mop in his hands. The corridor air pressure shifted. The corridor froze. The detainee, a man in his early 40s with the hollow eyes of someone who'd spent 3 years in a federal holding facility, stood motionless at the intersection of the main hallway, his federal escort beside him, his gaze locked on Katie restocking supplies at the medication cart near room for 12. His lips moved. A whisper. A name that belonged to legend, to radio chatter across Helmand Province, to enemy briefings that spoke of her like men speak of storms they've survived. Al-Saida Al-Zaka. The Blue Lady. The orderly froze with a mop in his hands. The corridor air pressure shifted. Katie's hand stilled for exactly 1 second. Not trembling. Not hesitating. Just pausing. Then she continued her work, her shoulders level, her breathing unchanged, because she'd learned long ago that recognition was a luxury she couldn't afford. But the detainee's voice had carried, low, reverent, terrified, and voices like that have a way of finding ears they were never meant to reach. A Marine staff sergeant working security detail on the detainee transfer was standing 15 feet away, his tablet in hand, and he heard those 4 syllables. His head turned. His eyes narrowed. He'd been checking manifests, routine federal custody paperwork, the kind of work that doesn't require thinking until something makes you start. He knew that call sign. Every Marine who'd served in Helmand between 2011 and 2014 knew that call sign. It was spoken in hushed tones in barracks, whispered in after-action reviews, invoked in scenarios where soldiers talked about who they'd follow into hell and back. He moved to a quiet corner, fingers flying across his tablet's secure network, accessing classified citation databases that required clearance only 3-star officers and active JSOC personnel could normally reach. But the staff sergeant had been attached to Task Force 121 for 14 months, and his clearance ran deep. The citation loaded. Navy Cross. The words came off the screen like they'd been written in blood, for extraordinary heroism under fire. Leading an emergency medical extraction through sustained hostile engagement across 12 kilometers of hostile terrain. 18 casualties recovered. 0 friendly losses. Under command of Captain Catherine Margaret Morrison, NAS King Bay Medical Corps, Navy Medical Special Operations Command. The staff sergeant's jaw tightened. 18 casualties. He'd been one of them. 6 months of nerve damage in his left arm from shrapnel, months of physical therapy, a medical discharge that had left him angry and purposeless until the Marines offered him this job. He remembered the extraction. He remembered the woman who'd moved through the fire like she was choreographed with the chaos, calling air support, organizing the wounded, carrying a 230-pound Delta operator on her back for the last 2 clicks because his legs wouldn't work anymore. He'd never seen her face clearly, the dust, the smoke, the adrenaline made everything abstract, but he'd heard her voice cutting through the gunfire, steady as a metronome, calling out coordinates and assessments and solutions with the kind of calm that only comes from having already accepted your own mortality. He approached Katie. Not tentative. Not asking permission. He held the tablet toward her, and his own voice had dropped to that register that only soldiers use, the one that sits somewhere between respect and awe. Captain Morrison. The words came out like they needed to. Like they'd been waiting 3 years to be spoken to the right person. Is this you? The medication cart fell silent. A nurse 2 stations over pretended to count supplies. The orderly had disappeared with his mop. And Katie looked at the screen, saw her own name in official military letterhead, saw the dates and the location and the summary of events that had been sealed and classified and buried so deep that even she sometimes wondered if the memories belonged to someone else. Her hands were steady. Her face showed nothing. But her eyes held something that the Marine recognized immediately because he'd seen it in his own mirror, the weight of having lived through something that changed the geography of your soul. "That was a long time ago, Sergeant." 10 words. Exactly. Her voice had dropped an octave since that first recognition whisper, and it came out like a command even though it was framed as observation. She reached past the tablet and returned to her work, not dismissing him but closing the conversation, the way you close a classified file. But it was too late. The hallway had been listening. Nurses don't miss anything, they see the architecture of human fragility every day, and they know how to read the smallest signals. Word moved like infection through the hospital's nervous system, spreading from the medication cart to the charge nurse station, from the ICU to radiology, mutating slightly with each retelling, the nurse who saved them all. "She's here. Right here." By the time Dr. Mercer was leaving his office to begin afternoon rounds, he'd already heard 3 different versions, and his entire body went rigid with something that looked like rage but felt like terror. He moved toward the gathering crowd near the medication cart like a man walking into a hurricane. "What is this theater?" His voice came out sharp enough to cut. "What melodramatic performance are we staging in my hospital?" The words were theater all right, but not the kind he meant. They were the last gasps of a man watching the architecture of his power collapse in real time. He pushed past 2 nurses, demanding answers, his face going purple, his hands starting to shake in a way that had nothing to do with anger and everything to do with understanding that the ground he'd been standing on was dissolving. But then the elevator dinged. The doors opened. And a man in dress blue stepped out, decorated Navy uniform, Admiral stars catching the hospital's fluorescent lights like they'd absorbed actual sunlight, his presence transforming the corridor the way a storm transforms a room just by announcing itself. 2-star. Rear Admiral James Halloway, attached to Naval Special Operations Command, his face carrying the kind of authority that doesn't require explanation or permission. He walked directly to Katie. Not to Mercer. Not to the administrator who'd appeared, looking confused. He moved like a man with operational precision, and when he stopped in front of her, his salute was sharp enough that the entire corridor heard the snap of it, boot heels connecting with linoleum, hand meeting temple with the kind of precision that comes from 30 years of ceremony and respect. "Captain Morrison." His voice came out clipped, official, and the words that followed were the ones that would dissolve Mercer's remaining composure entirely. "Your decorations have been restored by executive order. Your service is no longer classified. Welcome home." The silence lasted exactly 3 seconds. Then the hallway erupted, not loudly, but with the kind of intensity that comes from realization colliding with context. The Marine Staff Sergeant was nodding. Nurses who'd worked beside Katie for 2 years were looking at her with new eyes, suddenly understanding the precision of her movements, the authority in her quiet voice, the way she'd moved through crises like someone for whom chaos was familiar terrain. And Dr. Mercer's face had gone the color of old bone. He backed away. His mouth opened and closed without producing sound. He turned and walked toward his office, not running, but moving with the kind of urgency that comes from understanding that your world has just ended. By 6:41 p.m., federal agents were waiting in that office. They'd been called by Admiral Halloway, authorized through the Office of Naval Investigations, with a warrant that had been signed the moment Katie's file had been accessed through classified channels without proper authorization, and when investigators began pulling Dr. Mercer's records, they found something that made the original violation seem almost quaint. He'd forged her personnel file. Not just once. Multiple times. Adding disciplinary notes that never existed. Inventing incident reports. Fabricating patient complaints. Creating documentation that looked real enough to survive initial scrutiny but collapsed the moment anyone with actual authority bothered to examine it properly. And underneath that, like the rot at the foundation of a building that's been slowly collapsing for years, they found 6 years of similar patterns, 3 other staff members terminated through falsified documents, 2 malpractice cases where Mercer had altered medical records to shift blame away from himself and onto colleagues, a medical career built on forgery and manipulation, and the simple fact that nobody'd bothered to look closely enough to see the cracks. The handcuffs were real. The walk from his office to the elevator was witnessed by 24 people. The television news vans arrived by 8:13 p.m. By midnight, his medical license was suspended pending criminal investigation. The hospital's legal team had already issued a statement disavowing his actions. And somewhere in the industrial district of Raleigh, in a future that was only 6 months away, Dr. Mercer would be driving a medical supply van, company uniform, no white coat, no authority, no stage, banned from practicing medicine, banned from being within 50 feet of patient care. His career transformed into a cautionary tale that hospital administrators would tell for the next 20 years. But that was the future. The present, 6 months later, belonged to Captain Katie Morrison, walking through Cedar Creek Medical's emergency department doors at the beginning of a night shift, her white coat bearing embroidered letters, Director of Emergency Medicine. The faded unit patch from Helmand Province was sewn inside the lining where no one could see it, but her fingers found it between difficult cases, a small ritual, a acknowledgement, a way of saying that the people who didn't make it home were still here in the decisions she made, in the lives she saved, in the precedent she was setting. That invisible strength was the most dangerous strength of all. Lieutenant Hayes was working as a volunteer coordinator, his recovery absolute, his body rebuilt through months of physical therapy, his purpose reconstructed around the memory of hands that had pulled him from hostile fire. He passed her in the hallway sometimes and they never spoke about Helmand. They didn't need to. The acknowledgement existed in the quiet nod, in the understanding that some bonds transcend memory. They exist in the muscle level, in the part of the brain where survival is encoded. Katie stood in the emergency department watching her team move through the organized chaos of a multi-vehicle collision, watching them work with the precision she'd trained into them, watching them make the kinds of decisions that save lives in the margins between seconds. A new nurse, young, nervous, overwhelmed, approached her during the lull after transport. "How do you stay so calm? How do you do this every day?" The question came out like a prayer. Katie reached inside her coat and touched the unit patch through the fabric, let her fingers find the texture of the patch, let the memory of those 18 people travel through her nervous system. "I learned from people who didn't make it home," she said. "They taught me that courage isn't about being fearless. It's about acting anyway." She paused. The young nurse was listening with the kind of intensity that comes from recognizing truth. Katie added softly, to herself and to ghosts, "Sometimes the bravest warriors carry stethoscopes, not guns." The emergency department doors burst open. Fresh casualties. Incoming multi-trauma. The organized chaos started again. Katie moved forward with her hand steady, no longer invisible, finally, irrevocably seen. If you've made it this far, you know the truth. Heroes don't announce themselves. They work the shifts nobody wants, make decisions in rooms that nobody's watching, carry secrets that could transform everything. If you've ever underestimated someone, if you've ever judged by position instead of character, subscribe to see more stories about the people society overlooks. And comment below, have you ever been completely wrong about someone you thought you knew?